N.O.A.H, the Neuroscience of Addiction Healthcare, is a unique and ambitious project. N.O.A.H is a multi-platform approach to help reduce the leading cause of death in America, the disease of addiction. It starts with the paramedic in the street, on their knees, helping the patient suffering from the disease of addiction, progressing to the therapist, discharging the patient from a N.O.A.H facility. It begins with education. N.O.A.H offers a formal educational curriculum for EMS paramedics, ER doctors, nurses, and related healthcare workers on the disease of addiction, a topic that has been tragically missing from paramedic and EMT training since its beginning. Beyond the classroom didactic portion of their education, paramedics will have the opportunity for clinical rotations at a N.O.A.H facility. Here, the first responder can dialogue with the patient and meet the person behind this disease, not just the stigmatized view from the streets. If we are to treat the disease of addiction successfully, we must first know what it is and dispel the ignorant myths and stigma in the medical community that lead to poor care. Oftentimes, paramedics impose their own punishment on the addicted patient, such as withholding care, making the patient walk in cold or walk out of his house in only their undergarments, all because they do not understand the disease of addiction and impose their own prejudice and stereotypes on this patient. The first key component is EMS education. Formal classes on the neuroscience and pathology of this disease are held, competency tests are taken, and paramedics for the first time have a true understanding of what the disease of addiction is. The second half of N.O.A.H is the treatment facilities. N.O.A.H centers are a secular training center. The majority of the time is spent learning about the neuroscience and pathology of addiction and how this affects the patients. In addition, N.O.A.H incorporates cognitive behavioral therapy, dialectic behavioral therapy, and cutting-edge treatments such as transcranial magnetic therapy. This approach not only addresses what happens, but also how and why it happens, and understanding the reason behind the behavior that goes along with the disease of addiction. Without this education, continued stereotypes and the mistreatment of the addicted patient will continue and directly impact a patient's ability to achieve remission, and we can expect to see the disease of addiction to remain the #1 leading cause of death in America. Currently, we are failing these patients. The disease of addiction accounts for the single leading cause of death among men 18 to 49 years old. Of course, N.O.A.H respects the beliefs of all people and their religions. However, the current faith-based approach of traditional 12-step programs has a poor initial success record. Remarks from AA estimate that 70% of individuals who go to AA for the first time relapse within the first year and return to their former use. Some studies estimate that an individual will go through a treatment facility 5 times before achieving remission. These statistics are wholly unacceptable. A top-to-bottom view of how N.O.A.H works. A patient is met in the field by a N.O.A.H-trained pre-hospital provider, and the patient is transported to an ER. N.O.A.H-trained medical staff will receive and evaluate the patient. If appropriate, the patient is admitted to a N.O.A.H facility for care. In the ER, the patient will be met by a N.O.A.H-trained hospital discharge planner or seen by an on-call HOA representative. Stakeholders in this endeavor include EMS educational bodies, such as NREMTP, to mandate mandatory addiction education in the EMS core curriculum, hospital system administrators and medical staff, private investors, insurance companies, community leaders, and national policymakers. Resolving this healthcare crisis requires the implementation of a coherent, contiguous, multidisciplinary approach. This is the mission of N.O.A.H.